Tonight, we want to take a look at the current black maternal health crisis in the United States and talk about how it's being exacerbated by the attacks on women's rights to choose. A black woman in Ohio is charged with felony abuse of a corpse. Now, all kinds of thoughts might go through your head about how someone gets charged with felony abuse of a corpse. But in this case, it happened after she had a miscarriage. She miscarried her child while using the restroom. Now, some viewers may find the details of this story disturbing, so I want to give you that warning. Brittany Watts, 22 weeks pregnant. She has a miscarriage. A forensic pathologist testified that the unborn fetus died before passing through the birth canal. The assistant prosecutor says the case isn't about when or even how the fetus died. The prosecutor accused Watts of plunging the toilet and argued that Watts left the baby in the toilet and went on with her day. The case is headed to a grand jury. Now, it's important to note that Watts went to the hospital at least 2 other times before having a miscarriage. Each time, she was sent home. This is happening in the same state that wanted to force a 10-year-old child, 10 years old, who was the victim of rape. They wanted to force her to give birth last year. The child was past the state of legal abortion in Ohio, and the victim's family drove her to Indianapolis to have an abortion. This comes after the United States Supreme Court decision that effectively overturned Roe v. Wade had occurred. Now, it opened up the floodgates for states to pass restrictive abortion access laws, laws that had been held up in appeals or entirely struck down. And Ohio isn't the worst one. They don't even have the most restrictive abortion laws. Take a look at this map. Comes by Planned Parenthood, and the states with the darkest shade of maroon have eliminated abortion access. Many others have restricted access, even for rape, even for incest, even for medical emergencies. Less than half of the states have completely accessible abortion services. Meanwhile, the Texas Supreme Court ruled against a woman who sought to get an emergency abortion. Kate Cox She filed a lawsuit to end a high-risk pregnancy. Her doctors say the pregnancy threatened her life and also threatened her future fertility. Her attorney spoke with CNN.
You get this order saying, yes, my abortion can go forward. My doctor can give me the life-saving care, an abortion, which is what I need right now. And then all of a sudden, a court steps in and says on a Friday night, we need more time to think about it. Now, it's been all weekend that Kate has been waiting. She and I have been in constant contact. She spent most of the weekend in bed. I mean, think about how you would feel in that situation. This is why it is completely untenable for patients to have to come to court and ask for court authorization for life-saving medical care.
On Monday, the 31-year-old mother of 2 left Texas to get the procedure done in another state. When you hear these stories, I see how you'd feel hopeless. I mean, what are your rights? And what role can alternative medicine play in protecting black mothers who are already experiencing healthcare disparities in the United States? Well, joining me to help answer those questions is Elie Mystal. He is a justice correspondent at The Nation. We also have Latham Thomas, a master birth doula, visiting professor of gender and sexuality studies at Brown University, and she's the founder of Mama Glow. I want to thank you both for joining me. Elie, I'm going to start with you. This woman in Ohio, she's charged with abusing a corpse. Was Roe v. Wade the only thing that stood in the way of states basically being able to criminalize miscarriages and other things, pretty much whatever they want?
Yes. The thing that was stopping Republicans from criminalizing womanhood was Roe v. Wade. See, the abortion debate has always been based on a lie. The anti-abortion crusaders have always lied about their true intentions. They have said all they're trying to do is protect the life of the unborn. That has never been what they were trying to do. What they have been trying to do, and what they have now succeeded in doing, is taking control over women's bodies against their will. That has always been the point of the so-called anti-abortion crusade. And we see this based on the laws that they are passing, right? If you talk to people on the street, and I have done this myself, if you talk to people and you talk to them about a reasonable compromise, all right, about what abortion rights might look like, a reasonable compromise most people will go for is the idea that before fetal viability, when the fetus cannot exist outside of the mother's womb, that the mother should still have control over her body. After fetal viability, when the fetus can be safely removed from the mother and have a chance at life, that is when the state should take an interest in whether or not what happens to that fetus. If you tell people that compromise, most of them will go for it. That compromise that I just said is the definition of Roe v. Wade. That was actually the law that was in place that Republicans took away from everybody because of their crusade to control women's bodies.
And we see how that plays out in a case like the Ohio case, Latham. I mean, this girl, this woman, she went to the hospital. It's not like she just had some rogue birth ceremony inside of a toilet. She went to the hospital. They sent her home twice. Is this common? Is this what happens? It's mind-boggling to me.
Yeah, I mean, the whole situation is unfortunate. As a person who actually experienced a miscarriage in public, in a bathroom, in a toilet, it does not happen at the time of convenience. It does not happen in the comfort and the best setting possible. It often happens at the time that you least expect it. But what we do know is that many people feel that something's wrong. And what this woman did more than once was go and check on her care. She went someplace. She went to a place where she was supposed to get treated and was sent home. And then it was at home that she actually passed the miscarriage. And so if she was allowed to be admitted, if she was checked, if there were actual precautions taken by the healthcare system, she might have been admitted and might have been administered medication that could have helped her to pass the pregnancy, because they would have found out that maybe there wasn't a heartbeat, right? And she would have eventually had to terminate the pregnancy. It would have either passed on its own or through a medical abortion. And what I think is so challenging about all of this is not only are we talking about taking away reproductive rights, we are also talking about bodily autonomy in a time where someone has to make a healthcare decision. If you leave a baby that is no longer alive inside of the body, that tissue that's no longer living becomes dangerous inside of that person's body. And so them making a decision about whether or not, yeah, go ahead.
No, I just want to ask you a follow-up on that real quick, because this is still mind-boggling to me, given that, as you said, this is a fairly common situation. When a mother hears from the hospital, look, there's nothing we can do, you're not in any immediate danger, just go home. What should they do? Is that when people like you come in? Is that when the master doula comes in? Is that when the midwife comes in? Is that what do we do?
So this is why in this moment that we're living in, abortion doulas are so important, because these are people who help not only with logistical support, help us to understand what's happening in our bodies, help us to navigate care options, including medical abortion, which is absolutely safe. I know there's a lot of propaganda and a lot of conversation about whether or not it's safe. It is safe. People up to 11 weeks of pregnancy can take the abortion pill and safely have a miscarriage at home. For many people, that's also a more compassionate choice that makes them feel less traumatized by the whole experience. And then after which point, when you get to like 20 weeks, you know, that's a time where you do have to go in for a procedural. But before that, many people don't realize they're pregnant. There's some people who up to 8 weeks don't know they're pregnant.
Wow. And so with these Ohio laws, not knowing can still put you in a space of criminalization, or knowing and making a decision to simply pass a baby in the bathroom because you have no other choice could lead to you going to jail. We're going to talk about how that happens, why that happens. We got a legal expert, we got a medical expert here, a master doula in the building. We'll talk about that. Everybody, we're going to take a quick break. Stay right here. When we come back again, we'll discuss options for women who are looking beyond the traditional birth setting, and we'll also talk about what we can do to change these laws. Stay here. Welcome back to the Griot. Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women. That's according to the Centers for Disease Control and Prevention. The national figures are similar for black women in Mississippi. In 2020, black women in the state were 4 times more likely to die from pregnancy-related issues compared to white women. That's according to data from the state's Department of Health. The Maternal Mortality Review Committee says 80% of pregnancy-related deaths in Mississippi between 2016 and 2020 were considered preventable. Because of the medical disparities for black women, there has been a rise in at-home births. Recent data from the National Partnership for Women and Families show a 30% increase in black women who gave birth in a community setting between 2019 and 2020. Back with me is our Black Maternal Health panel. We have Latham Thomas, a master birth doula, founder of Mama Glow, and visiting professor at Brown University. Them accolades keep piling up. And we also have Elie Mystal. He is a justice correspondent at The Nation, a trained attorney from one of them fancy places that shall remain nameless for the moment. Elie, talk to me about Ohio's new law. Voters decided during the November elections to enshrine abortion protections into state law. How does that impact this case that's about to go to the grand jury?
Well, probably it doesn't, because what this woman is being charged with, as you mentioned, is not having an illegal procedure, but illegally disposing with the body. It's kind of an old school way to get at abortion rights. A lot of states, what they did when they couldn't outlaw abortion straight up, was to basically criminalize how people deal with the afterbirth of an aborted fetus. So you can remember there are states that had like fetal burial laws and that kind of stuff. That's what this woman in Ohio is being charged with, right? So the actual Ohio.
But Elie, let me ask you a question about that. I get that this doesn't directly connect to the law, but is it a climate issue as well? Is there a strategic component to this? Because it seems to me that if now under the federal kind of context, we've decided that abortion rights are no more, and people are saying that this baby is a baby at conception, right? Science be damned, and all that stuff is happening, then it makes it easier to sell to somebody the idea that if a woman has a miscarriage in her bathroom, as this young woman did, after being sent home from the hospital, I want to stress that again. It isn't like they said, come into the hospital. She said, no, I'm going to the bathroom. They sent her home twice and said she'd be fine. She has the miscarriage in the toilet, and then they charge her with abusing a corpse. Does the climate post-Roe decision kind of a Roe reversal, does that allow for this stuff to happen? Or is this a strategy to foment support so that more people be like, yeah, that's right. This is what we need to be doing?
Yeah, so obviously, yes, the climate that we are living in is why these lawsuits and why these cases are happening. I'm just pushing back on the idea that this is just the climate post-Roe. This has always been the climate for Black women in red states. This has always been what they are being what they are challenged with. They're always being sent home from the hospital and not getting efficient medical care. They're always having their bodies criminalized by the system. The only thing that happened after Roe is that it made it easier to do it. But this has always been the reality for Black women in red states. So when you think about what Ohio did, one way that I don't in any way mean to denigrate the achievement of Ohio women passing that constitutional amendment to the state constitution. But one way to think about it is that what we're seeing around the country is white women standing up for white women's rights, right? Like this is it's a very white women-led thing. The problems that we have with Black women, with Black maternal health, those remain, and those have always been there, and nothing is happening to address that, because nothing is happening to address the fundamental.
That's a great point. Let me bring Latham in on that point. Latham, what are some of the issues here that we should be talking about with Black women's maternal health?
I mean, it's interesting because this is a reproductive justice issue, right? When we're talking about the right to have a child, how we do that, whether or not it's safe, whether or not we have health care, access to the social service safety net and resources, right? The right not to have a child and what that looks like for us in a landscape like this. And also the right to raise our children. And if you think about at every juncture along the life course, we are threatened. Our children's lives are threatened by the state. We are threatened during a pregnancy to the point where Black women are even afraid to conceive and have children because they think that the outcome is death. We need to get to a place where we are actually looking at this as a human rights issue, not just a siloed Black issue, because what happens to our community really speaks to the healthcare system writ large. And so, yes, like what we're seeing is that people are standing up and saying, I want a different option. I want to vision something that's alternative, that's a vision for the future. But that actually takes us back to what we were doing before, which was looking at midwifery care, out of hospital birth, birthing within birth centers, actually divesting in hospital systems that do not support us. So taking a stand, suing, which we've seen some civil rights lawsuits actually with Cedars-Sinai Hospital, with Charles Johnson and the death of his wife. He sued, and there's a civil rights lawsuit actually currently underway at that hospital because of a medical negligence, but also because this woman was Black and she was healthy and there was no reason for her death, right? And so I think that what we're seeing here is people are standing up and saying, we have the education, we know that there's other options, we can create something different. And what it does take is, the information dissemination. More people need to know that there are other options outside the hospital. Because what's happening, right? We're telling people that once you get pregnant, this is your cure option. But we know that there are harms that happen in the medical system. We know that people are faced with medical violence, obviously racism. And if we talk about white supremacy, I really want to talk about all facets of it that show up in medicine, which is obviously racism, homophobia, transphobia, fat phobia, ageism, ableism. All these things show up inside of our care system, right? And so
I would just like to add,
beautiful.
I honestly do not think most white people have any idea of how different the level of care is when you are Black, and particularly when you are a Black woman. When my wife has medical issues, we have to go into battle mode just to get the level of care that white people, my wife's white friends, think that she's entitled to. They have no idea what she actually has to go through to talk to any doctor, to get any kind of medical support. So we have to go into full lawyer mode, basically with the, hanging the threat of my, educated lawsuits on them to get any level of, to get comparable care to what the average white person gets just walking in off the street. I don't think most white people have a conception of just how bad it is out there in the medical community. And these abortion laws, these anti-abortion laws, that's why they're so directly leading to increased maternal death rates, because you've already have
because we're already vulnerable, and this just makes it even more so. And they're getting clever, right? I mean, they're talking about restricting out-of-state care. They're talking about banning travel for an abortion. They're making it illegal to mail in, to get a pill in the mail. All of these things are ways to continue. Yeah, right. It's all a way to really just shut down all women's access to reproductive freedom, reproductive rights, reproductive justice. But we're going to keep fighting. That's why Ellie's here. That's why Latham is here. And we're going to keep telling that story here on The Grill. So stay with us, y'all. We're going to have more conversations just like this.